Hey, Jeff Nelson of VegSource. Today we have back one of the most knowledgeable and most accurate guys when it comes to health and nutrition, Dr. Peter Rogers. Welcome, Dr. Rogers.
Hi.
Thanks for joining us today. If you don't know who Peter Rogers is, I did a 10-minute intro of him in my last video. You can go and watch that. You get all of the details. Suffice it to say, he went to Harvard, he went to Stanford, he was at the top of his class, he's got a photographic memory, and he's a certified genius. So he knows his stuff. He's written a number of excellent books. And today I want to talk about his latest, newest book. And it's like a textbook. It's almost 800 pages. And it's probably the best medical book ever written. Okay, why? Because it accurately describes the causes of all the biggest diseases. It tells you what the causes are and how to avoid these diseases altogether, basically. Medical textbooks, today mainly focus on how to treat diseases, not what causes them, and not on how to cure them. So you can learn the cause and the cure and how to prevent diseases in Dr. Rogers' new book. It's called Reformation Vegan Renaissance Bible, The Poor Man's Guide to Health, Nutrition, and Toxicology. Okay, I'm going to take an exception to part of that title. I don't know that I would call it The Poor Man's Guide because the book is a little pricey, but it's completely worth it. If you buy it, you will not regret it. And it's done in a way that Dr. Rogers does many of his popular videos on his YouTube channel with lots of illustrations and charts and visuals and jokes to help you understand everything. And I'm going to link to his channel down in the description. Be sure to subscribe if you aren't already. And what you're going to find when you follow advice from Dr. Rogers is that you're not getting food industry research. You're not getting drug company research. That's the stuff you absolutely want to avoid if you're trying to become and stay healthy. Pete, someone that you and I both know, said that Dr. Furman and Dr. Kahn recently gave some presentation about the truth about fats and heart health. And that was what their event was called. I didn't watch it, but our mutual friend, she told me it was the same old, nonsense about how a low-fat diet is dangerous, how eating at least a half ounce of nuts at every meal enhances micronutrient absorption, and it improves satiety and weight loss, and that good fats prevent dementia. So, of course, we know this is all nonsense. And in fact, it's based on salad dressing science. It's based on research paid for by companies trying to advertise their foods. It's not real science. I've shown this before in a couple of videos. Maybe it's time to do it again. But excuse me, for example, I've shown studies about the supposed importance of fat for absorbing nutrients. And the studies are paid for, and in some cases even conducted by salad dressing companies. Now, the average researcher isn't sitting around coming up with the idea of, testing high-fat salad dressings. But this is the research that some people like Dr. Furman, even Dr. Michael Greger, that they cite to claim that vegans should be adding fat to their meals. These are studies that are done by Kraft Foods. They did the one that's in the Journal of the American Dietetic Association. Kraft Foods employees, in fact, were the researchers, and they found that adding a full-fat salad dressing to a salad increased absorption of fat-soluble vitamins like vitamin A and E, compared to someone eating the same salad with a fat-free salad dressing. So Unilever is another company. They paid researchers as well to investigate the impact of high-fat salad dressings on nutrient absorption. They published a study in the American Journal of Clinical Nutrition. They found that addition of high-fat salad dressing increased the absorption of beta-carotene, which is a precursor to vitamin A, from salad vegetables. And even Hidden Valley got in on the act. They did some and they tout it in all their marketing materials. So wow, having high fat with your salad, you absorb more nutrients, right? Fat-soluble nutrients. This is actually false. This is completely false because I have shown the research that shows that adding fat to your salad will only make you absorb nutrients faster. You'll still absorb the same amount of nutrients, whether you eat it with a non-fat or a high-fat dressing. It just takes longer with the fat-free dressing, like it takes over 12 to 18 hours rather than, say, 6 hours if you add the fat. So you kind of see what they're doing. The most you can say is that adding fat speeds up absorption of some nutrients, but you're still going to absorb the same amount of nutrients from the same meal no matter whether you add the fat or not. Kraft, I think in their research, they tested people at 6 hours and they said, look, the people using our dressing absorbed more nutrients. And then they stopped the study. They didn't measure anyone after 6 hours. Other researchers then who repeated this research and who don't work for the salad dressing industry, they did the same test, but they measured absorption periodically over 24 hours. And they found that the salad dressing made no difference ultimately in the amount of nutrients absorbed in either group. It just sped it up with the fat. So, here you find vegan doctors, they're taking salad dressing industry research, and they use it to try and convince vegans that, you need to add nuts, you need to add avocados or olive oil or some other fat on your food. That's salad dressing science. That's what they're touting. And that's like a study paid for, about milk and strong bones paid for by the dairy industry. It's a gimmick. So there's lots of gimmicks out there. And one thing I really like about Dr. Peter Rogers is that he doesn't do gimmicks. He doesn't give you salad dressing company science to teach you what matters for your health, as opposed to what matters to the bottom line for Kraft foods. And remember, people are going to be saying, you'll get more nutrients, you'll be deficient if you don't take my advice. That is fear marketing. And who sells fear? Who sells, the fear of deficiencies? Well, usually it's people who use gimmicks and people who sell supplements. The same goes for the rest of the arguments that, were being made. I could do a video on this, the supposed dangers of low fat. I haven't ever seen a study on that. No one's ever presented a study. The amount of fatty acids, the DHA thing. We know, I've done a couple of videos that Dr. Furman's DHA product doesn't even reach or have any impact on your brain. And this has been shown in spinal tap studies done at UCLA, and I've done a couple of videos about it. Anyhow, this cherry picking and puffering, remember, it's salad dressing science. Okay, I didn't mean to go off so far on a rant there, but if you have standards, if you don't want to be duped by advertising science, you need to listen to people like McDougall. You need to listen to people like Peter Rogers and buy their books. So, Peter, how long did it take you to write this new book?
Well, it took me a while because I've kind of been adding up the material. I had said to Chef AJ a couple of years ago, all the medical textbooks are wrong. All the biochemistry textbooks are wrong. I own like about 7 biochemistry textbooks, okay? They don't have the important information. And what I come to realize is the medical school biochemistry textbooks and pathophysiology textbooks, they basically teach a student how to deal drugs. They don't teach them what's really going on. What I mean by that is every single internal medicine book, pathophys book, it basically says nobody knows what causes the disease. It's associated with aging. It seems to be partly genetic. You might as well take our pill and slow it down. And then you start reading the literature, and there's actually a lot of useful information. Then you read the biochemistry book, and there's nothing about toxicology, which is, highly relevant. For example, you won't find any mitochondrial inhibitors in your standard biochemistry textbook. But then I started going through the literature. Basically, my kids are grown up. My wife works. I sit around by myself studying a lot. I don't got much else to do. So I found over 50 mitochondrial inhibitors real fast. And many of them are common. And that's a big deal because what protects your brain from dementia and the ability to pump calcium out of the cytoplasm to prevent excitotoxicity effects, a major cause of dementia, is that you can produce adequate ATP. So most people are sort of like burning a candle at two ends, if you will. They're ingesting all these excitotoxins and these mitochondrial inhibitors. So they're not only, ingesting toxins to their brain, they're blocking the detoxification system. Stupid. They don't know any better.
Wow. Well, this new book, I've just started it, really. It's quite an undertaking to write and to read, too. It's basically the Encyclopedia Britannica. It's comprehensive coverage, and it's a great resource for everyone. I think it supplants Gray's Anatomy and should be standard reference for medical professionals as well as the public. So
yeah, because that was what I was basically trying to do. I basically have rewritten the medical textbook and the biochemistry textbook. I didn't cover all the introductory type information. I simply added the stuff in that should be in there. For example, all these nutritional pioneers, not a single one of them is in any of the medical textbooks, okay? And they're not even in the nutrition books. You read, I have this advanced, biochemistry nutrition book. It doesn't mention a single person from the nutrition pioneers that we all know, okay? There's no Kempner in there. There's no, Ornish, Burkitt, any of them. They're never in the books, okay? Elselson's not in any of the books on coronary heart disease, and I have the most recent edition, the Ivy League edition, okay? It's BS, okay? And then now they're trying to say it's due to inflammation. Well, if it was due to inflammation, how come, Esselstyn could cure it and reverse it with a low-fat vegan diet,
Exactly. Well, I mean, you have a new look today. I think we're ready to start your talk. If we are, why don't we get underway? Maybe you can tell us, about your new haircut and your wardrobe.
Okay, well, I had a little fun with this because it's based on Martin Luther, the Protestant Reformation, if you will. And I thought, well, gee, you know what? I could do the same thing. And so I kind of went down that path, and the book kind of follows that path. It starts in the first chapter with the 25 Theses. Martin Luther had 95, but 25 is enough. And I sort of coordinate that with, I'll show the theses, like what's the problem, and I'll also show how it's already been corrected. As a matter of fact, tremendous amount of good information is already available. It's just no one knows about it. So I'll include that as I go through the problems. I'll include the solutions to them.
Beautiful, beautiful. Well, let's get going here. I can hardly wait.
All right. So this is the medical reformation. We're not going to be able to talk about abdomen today. It's too much stuff. But we're just going to go through the medical reformation stuff. And I'm going to go mostly by the book, but I've added a whole bunch of stuff because with a book, you're constrained by all the formatting issues, and it's very cumbersome to make any changes versus where a talk, I can add a lot of things. So, okay, Martin Luther is going to take over here. As the Lord spoke to the people in parables, let us begin with the story of the zookeeper. Exhibit A happy, healthy monkey. Once upon a time, the zookeeper for the herbivore monkeys went on vacation, and a medical doctor agreed to moonlight at the zoo. He figured his experience with talking primates would serve him well. Unbeknownst to the doctor, the new commissary intern had been feeding the monkeys the same diet as the jaguars. This is known as the jag-off diet. The herbivore monkeys got sick, and they were too tired to climb the plastic trees in their cage. Paradoxically, the female monkeys seemed happier because the male monkeys were no longer trying to mount them. The MD gave them pill after pill after pill, which slowed things down a little bit, but the monkeys kept getting sicker. It took 2 pills to control the monkey's high cholesterol and 3 pills to control the monkey's hypertension. The MD also ordered an endocrine consult for the monkey's worsening diabetes, perhaps a continuous monitor for glucose with an insulin pump and artificial intelligence, auto-programmable with insulin dosing. Maybe that would help. The MD also wisely consulted the cardiac surgeon to evaluate the monkeys for open heart surgery for coronary artery bypass graft. The surgeon went through the standard consent for CABG, C-A-B-G, with the monkeys: graft occlusion, myocardial infarction, heart attack, chronic arrhythmia, permanent pacemaker, multi-organ failure, cognitive impairment, stroke, death, painful death. The monkey was scheduled for the operating room the next day. That morning, the zookeeper returned from vacation. The operation was postponed. The zookeeper put the monkeys on a plant-based diet. The monkeys came off all their pills and made a full recovery. However, the male monkeys started again trying to mount the female monkeys. One of the female monkeys filed a complaint that the zookeeper was a misogynist. The zookeeper got fired. Then all the monkeys died. And who was the zookeeper? Walter Kempner, the rock star of nutrition. He was very popular with the ladies. He's sort of like the Moses of the vegan diet and nutrition. And Dr. McDougall had said that Dr. Kempner was probably the greatest doctor who ever lived. The burning bush over here has revealed to Dr. Kempner the 10 commandments of nutrition. And over here, of course, we have another picture of it. And this has an entirely different meaning, the burning bush in this context, than in the chapter on STDs. Okay, the 10 commandments of nutrition. Starch is the true god of food. Thou shalt put no other foods before starch. Starches include potatoes, sweet potatoes, rice, beans, oatmeal, quinoa. By the way, some of the healthiest populations in the world, like the Okinawans, ate primarily sweet potatoes earlier in the 1900s. They have only 1% fat. Rice, like white rice, has only 1% fat, which kept a lot of Japanese and other Asian persons very healthy. So this idea about needing a lot more fats, it doesn't pan out when you look at the epidemiology. Potatoes, a lot of healthy people surviving primarily on potatoes, only 1% fat. Okay, the other big secret is dietary fiber is converted to short-chain fatty acids in your gut, and the 2-carbon acetate, 3-carbon propionate go to the liver. They're used to make fat. So you get the fat you need in a protective fashion through fiber. And then the 4-carbon butyrates are used to maintain the gut's tight junctions, prevent leaky gut, prevent autoimmune disease, all that stuff. Okay, but starch is the way. Starch is the entree. I like your quote, Jeff. Fiber is life, pharma is death. That's a good one, too. Okay, starch should provide about 60 to 90% of your calories, depending on how much you exercise and your lifestyle and where you live. You can eat more fruit to satisfy the additional calories. You know, if you live in Hawaii or something where it's tropical, you're going to have fruit more available to you all year round. But for people in colder climates, it's kind of expensive, doesn't store so well. And starch satisfies hunger better. Okay, in general. Okay, thine brain is a thermostat. What that means is you have a set point. The hypothalamic hunger center, like the arcuate nucleus, it forces you to eat exactly the amount of food that you do. What the typical person hears is exercise more and eat less. But that's really the mantra of chumps. It does not work. You have to change what you eat because then you reset the set point and your body will adjust itself to the new diet. You're not going to win fighting the hunger drive, not long term. Okay, vegetables are a great source of nutrients. They provide like nitrates, for example, magnesium and other good things. Okay, for every meal, just ask yourself, what's the starch, the vegetable, and the fruit? Okay, plants provide what you need to spread your seed. Makes you better looking. You're thinner. You're more of an optimal body weight. They give you everything you need, you know, and they give you the things. What are most Americans deficient in? They're deficient in potassium, magnesium, fiber, nitrates, antioxidants. Those all come from plant food. So the good stuff that you want, it comes from plant food. And that's what most Americans are deficient in. It's not just a diet. You don't just do it for a month and then everything magically reverts to normal like you're 18 years old again. You know, you have to eat healthy every day. Thou shalt not eat meat. Meat makes you fat. Milk is liquid meat. Cheese is meat jello. When you eat cheese, you look like the animal it came from. A cheese pizza on your plate looks the same on your plate as it does in your arteries. Okay? Meat causes leaky gut, xenocylitis, a whole bunch of problems, increases your cancer risk, et cetera, et cetera. It's not good for your health. You know, I'm not an animal rights guy. If it wasn't for the health issues, I would eat it. But I want to be healthy. I want to keep my arteries open. You get older, you get more fragile. So you got to be more careful about your health or you lose it. Okay, number 7, thou shalt not eat oils. Oils are liquid fat and they make you fat. They are bad for blood flow. They are tumor promoters. They also increase your risk of leaky gut. When you go to the restaurant, choose buffet and eat the salad without the dressing. Skip the dressing and you look better undressed. Salad dressing is for wimps. Okay, thou shalt not commit adultery with junk food and fast food. Thou shalt not bear false witness against the vegan diet. There are 2 kingdoms of food. There is a land of the healthy aging like Tarahumara, Okinawa, Yanomamo, rural Kenya, Sardinia, Loma Linda. And then there is the meat of the sick and the fat like Nauru, the Pima, and most Americans. So what I'm basically saying is epidemiology is very helpful. I mean, where else can you get a sample size of 1 billion people, okay? And the people eating primarily plant foods, they're skinny and healthy. The people eating primarily oil, meat, and processed food, they're fat and sick, okay? Like the, Animal House movie. You remember when Dean Wormer said the flounder, fat, drunk, and stupid's no way to go through life. And so what I would say, fat, sick, and stupid's no way to go through life, and it's preventable. All right. Okay. I've talked about the siren temptations of nuts, oil, sweet seeds, the siren song of philosophic vegetarians. Okay. Because there's different types of vegetarians. You can be a vegetarian vegan for health reasons like me, or you could be it for religious reasons, or you could be that for animal rights reasons or whatever. And so for health reasons, it'll get you to eat as healthy as possible. I call it orthodox veganism. The best diet, low sodium, low fat, low protein, whole foods, 100% organic if possible, 100% vegan, starch-based, no alcohol, no caffeine. Okay, does that sound like too much of an effort? Get an attitude of gratitude. Okay, heal your objections to veganism and it may heal you. And what I mean by that as well is I hear all the time from patients and friends, oh, well, that's too much. You're too dogmatic. You're too absolutist. And I'm like, the reason I say this is because that's what works. Most people, just like we have herbivore physiology for digestion, I think most people tend to have what I call a herbivore mentality. The safe place is the middle of the pack, okay? But that's average. That's mediocrity. That's like, well, at least I'm not as fat as my cousin, whereas your aspirations should be, what's the best I can do? And I think the proper response would be, gee, all I got to do is eat these plant foods and I have a chance to keep my arteries open, keep my brain functioning optimally. Why not? Okay, when the rest of your age cohort is fat, diabetic, and woodless, hooked on hypertension pills, mentally slow, and worried about open heart surgery, you'll be waking up with a wood. Okay. All right. Thou shalt not covet thy neighbor's plate. Okay, a GMO, hormonally hypertrophied, all this processed food. It's terrible. The big thing about processed food is they put tons of preservatives in it because for a processed food company to make money, the food has to have a long shelf life so it doesn't get sent back to them. The big problem is mold growing in there. When mold grows in there, what happens is, to prevent the mold from growing, they put lots of fungal inhibitors, but fungal inhibitors very often are mitochondrial inhibitors, and you need your mitochondria to produce energy. So you have less energy, plus your brain's less able to protect itself from other things like excitotoxins. So you don't want that. Okay, here's the most important painting ever made. this is Adam, the creation. There's God making Adam. So this is the idea of man creating God's image. And the reason why I say this is because this declares that man is part divine as well as part beast. And I think this is an important thing in healthcare, to see mankind, the individual, as something special. Because once you say that there's nothing special about man, he's just a talking primate, just like a monkey, but he talks, you sort of dehumanize him and you lose your obligation to do right by him. Because there's a tremendous problem in healthcare of seeking profit rather than what's best for the individual. Because I can tell you, it's always more profitable to sell the patient a drug or to operate on him than it is to talk to him and educate him. So I think medicine has to get back to these Bible ethics, in my opinion. I've been a doctor over 30 years, board certified 3 fields, and I've worked in tons of places. Okay, and I think this is what's missing in medicine, is that the superstructure above, the rich billionaires who run the show, they just want to make money, and they really don't care at all about the patient. And if it comes to choosing between the patient and money, they'll go with money, and the patients suffer from that. Okay, so a simple way to be healthy is just to live like Adam and Eve in a sense. Keep your indoor heating and plumbing, but just eat simple stuff that grows outside. Real foods, whole foods, plant foods, And Genesis 1:29, behold, I have given you every plant yielding seed, which is upon the face of all the earth, and every tree which has fruit. It shall be food for you. Simple, and it works. Okay. Now, here's Martin Luther. This is when he was at the Diet of Worms, when they called him into question about what he'd been saying and writing about indulgences and other things of the Catholic Church. And Martin Luther had a couple quotes. He said, the simplest peasant with Scripture knows more than the Pope without it. Okay, so I would transfer that to health and say the medical reformation means the simplest peasant with a low-fat vegan diet can save more patients than the head of Harvard Hospital without it. And that's true. You look at all these blue zones, Dan Buettner, National Geographics, and a lot of the other epidemiology of healthy populations. These people were not a bunch of nutritional scholars, okay? Many of them were illiterate, okay, living out in rural places. They just ate healthy stuff that grew around them, the traditional ways of doing things. Martin Luther at the Diet of Worms also said, I do not accept the authority of popes and councils, for they have contradicted each other. My conscience is captive to the word of God. I cannot and will not recant anything. For to go against conscience is neither right nor safe. Here I stand. I can do no other. So help me God. Amen. Okay, this is the cover of the book, The Medical Reformation, and then followed by the Vegan Renaissance Bible there. Poor Man's Guide to Health, Nutrition, and Toxicology. Okay, here is a painting, a beautiful painting here of Raphael and the Stanza Signatura in the Vatican. And what he's basically showing here is primarily a bunch of Greek scholars in primarily a Roman architectural building. But what's beautiful about the School of Athens was it was sort of an integration of a whole bunch of things. And it showed tremendous respect for learning over the ages. And what I'm trying to say is I see something like this Renaissance idea happening now on the internet with these vegan channels like Chef AJ, like Veg Source with Jeff Nelson, and there's other really good ones as well. And basically, for the people who want to learn, you go out there on the internet, you can see all these videos, and you can really learn a lot fast. And I can tell you, I'll have medical students, I'll have residents come follow me around sometimes for a while, and I could teach them more in 2 hours than they learned in 8 or 12 years of medicine. And I know you say, how could you say that? And I'll tell you why. Because they never learned the 3 most important things: nutrition, epidemiology, and toxicology. And they're relatively easy to learn. Okay, so anybody who really wants to learn, you just go watch videos at these channels. You will soak up so much information. It's not even funny. Okay, and you can hit the print screen button if you like a picture, you like a quote or something, and you can make your own little collection, and you can really learn from that. So what I'm trying to say is, this is the vegan renaissance. We're living in the middle of it right now. Okay, here's the Tower of Babel, Babylon, the prototype of an evil place, okay? And conventional medical books, like I said, they all say the same thing. The disease associated with aging, genetic, nobody knows the cause. It's idiopathic. And you know what idiopathic means? It means the doctor's an idiot and the patient's pathetic, okay? Then the next thing they always say is, you might as well take our pill and try to slow it down. So their students are taught, match the ill to the pill and send a bill. All medical schools are basically training to be an internal medicine doctor, okay? And it's all based on that, selling drugs. And I used to take it for granted that that's true. I thought it was great. Look, we can cure all these diseases, take these pills. But later on, I learned the pills don't work. I mean, or they work a little bit maybe, depending on the disease or the situation. They're good for replacement. Like if you have to replace thyroid hormone, you can replace thyroid hormone. But if you're trying to control your blood pressure, for example, it's a lot better to control it by eating a healthy diet than a pill if that'll be adequate, which it usually is, at least early on. Okay, a patient taking medications for diseases that could easily be cured by a low-fat vegan diet, they're like a chump. They're getting milked every day like a cow, okay, by the system, giving money to the system. And eventually they just keep getting sicker and sicker, and then they get surgeries, okay? Here's basically, like the most important thing I ever learned in over 30 years of being a doctor is that you want to eat starch to satisfy your hunger, because starch is a polymer of glucose wrapped in fiber. And what happens is it's low caloric density. So it stretches the stomach, and that stretching of the stomach satisfies your hunger early on. Then it passes through the intestinal tract, and it takes time for the digestive enzymes to peel the fiber away from the glucose before it's absorbed into your blood. And that creates the effect of a slow release energy pill. So you maintain a normal blood glucose level a prolonged amount of time, and you're in the zone, if you will. And that way you satisfy your hunger with the least number of calories. That makes you skinny. And then the fiber does all kinds of other good things. All right. And you get the nutrients that you need. This is what you want to happen. You don't want simple sugars, because in excess of simple sugars, like let's say you're drinking sweetened processed food drink, soda pop or something, you'll spike your blood glucose, and then the pancreas tends to overcompensate. It's not used to such a sweet thing in nature. It'll drive your glucose down. You end up with rebound hypoglycemia, for example. Okay, but this idea of eating a lot of starches, it's the most important thing we know about health and nutrition right there. Okay. One sentence teaches you more than a textbook will about nutrition. This is a McDougall quote: all long-standing healthy populations eat a starch-based diet. There are no exceptions. Okay. All right. And here's what it basically comes down to. So here's you. You are here in the game of life. And basically you can get away with a lot of stuff up to about 30 years of age. You can go out at night, drink alcohol, okay, stay up till 2 o'clock in the morning, get up at 6 a.m. and go to your job, whatever it is. All right. You can't do that when you're 50. If you did that, you just would not be functioning very well. And what I'm trying to say is, the older you get, the more fragile you get. Your body loses a physiologic reserve to heal and fix things so quickly. So at 35, people start noticing some problems, okay? And what I'm saying is, what the usual person does, they keep on eating the meat, oil, processed food diet. They get on more and more drugs and pills. Then they start going for surgery. So it's drug, chop, 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 bye-bye money, prematurely dead. Okay. Plus, I can tell you, my internal medicine friend tell me, and my experience matches this, most of the people I see, most patients after 60, they're cognitively slow. So, and then they just keep on drifting down. And the slower they get cognitively, the less chance there is they'll ever realize what's going on and learn how to change their diet and get healthy. Plus, nowadays, it's more complicated because there's a lot of toxins in the food. There's toxins in the air, etc. And you want to learn at least about the common ones so you can avoid them. That's also a significant part of being healthy. But, you go down this path, low-fat, low-sodium vegan diet. The Johnson keeps working a lot better. You probably don't need any pills. I'm 60. I don't take any pills. Everything works for me. I don't have any diseases. You're unlikely to need surgery. I never had a surgery. I don't think I'll ever need one. Hopefully, I don't expect to. And you got a good chance to live about 90. A vegan population, low-fat vegan population, can be expected to probably live almost to 90. The Seventh-day Adventist, longest lived, well-documented population. The women were living to 89. The men were living to about 86. Dr. McDougall worked with that population, and he said a lot of them really weren't as healthy as they could have been, such that you could probably expect they can live a little longer if they really were doing everything right, so to speak. Okay, so that's about the potential as far as we know for a human to live on average, the average longevity if they do everything right, so to speak. Most people don't, though. And like I said, most people, they won't change their diet and lifestyle, but they'll just change it a little bit. But little changes don't tend to make much difference. We've talked about this before. You don't tell an alcoholic you can drink on the weekends. You don't tell a cigarette smoker you can smoke on the weekends. You don't do that anymore if you want to be healthy. Okay. So a lot of us are in this position here, like Dante. In middle age, I found myself in a dark wood and the path was lost. So they went from their joyful youth, they're running around all healthy, to all of a sudden they're middle age. They're working all day, long commute. They come home, they got to take care of the baby. They're not getting enough sleep. They're eating junk food, fast food on the way home, and now they're fat and sick. Okay, so you got to turn it around, otherwise you just go down the tubes. And what I'm basically saying here, this is Dante and Virgil at the gates of hell. And what it said on the gates of hell was, abandon hope, all ye who enter. And the reason I put that there is, what do you think conventional medicine says? It says that all of these things, obesity, diabetes, hypertension, impotence, coronary artery disease, cerebral vascular disease, they're all chronic diseases. What that means, chronic, is it means the patient never gets better. Do you understand that? They don't make you any promise whatsoever of getting better. They tell you, you will never get better. Well, just try to slow it down a little bit, okay? Whereas you go and you start reading about vegan diet, obesity cured, coronary artery disease cured, hypertension cured. Now, it's not always cured. The more chronic the disease, the more severe it is, the more difficult it is going to be to reverse it. You can still probably slow it down for real, but the sooner you get going on this, the better. Okay, so here's Martin Luther, 1517. He ushered in the Protestant Reformation, nailing the 95 Theses to the door of the church in Wittenberg in the town square. Dramatic event, and the publishing press was just coming out in those days, and people are like, oh my goodness. All right, so I've written 25 theses of chronic disease and other related medical problems, and we'll talk about all of these in a way that can help you. So number one, why do internists treat atherosclerosis with pills, which have a 0% cure rate, when a low-fat vegan diet with no oils has a better than 99% cure rate? The Esselstyn paper, July 2014, Family Practice Journal. Okay. Why do cardiologists treat coronary artery disease with stents, which has a near 0% cure rate, except, it can be real useful in the setting of an acute myocardial infarction, but that's a rare situation compared with chronic, cardiac angina, chest pain on exertion, dyspnea, shortness of breath on exertion, okay? But the low-fat vegan has about 100%, 99% cure rate. So why would you want to go with something that has a close to 0% cure rate? Most cardiologists, cardiac surgeons and vascular surgeons, they don't even know that atherosclerosis is a blood clot. That's an important point, because when I was a young guy too, I thought cardiologists, they are the expert on atherosclerosis. Also the cardiothoracic surgeon doing the heart surgeries, and the vascular surgeons, plugging in the bypass in the foot, and vascular interventional radiologists, which was my background, they have a lot of knowledge in that area too. But I've changed my opinion of that. They are a bunch of plumbers. A plumber is somebody who sees a blockage in a tube and tries to fix it. The cardiologist goes in there, inflates a balloon, or a surgeon bypasses it. That's plumbing. Okay, that's not the same as understanding atherosclerosis. The best scholars of atherosclerosis are the pathologists, and there's a couple reasons. Pathologists like Dr. Gregory Sloop, Dr. William Roberts, they look at it with a microscope. When they look at it with a microscope, they go, atherosclerosis is a blood clot. It's a blood clot. It looks like a blood clot. It's a blood clot. And that's highly relevant. We'll talk more about atherosclerosis, but what I'm trying to tell you is once you get that, it's a blood clot. By the way, I look at CT angiograms all the time. You can't tell them apart from a blood clot because it is a blood clot. All right. All right. That's a huge big deal. That explains a lot about the pathophysiology. That also means anything that causes the blood to clot increases the atherosclerosis risk factor. Trust me, that will help you a lot in understanding atherosclerosis risk factors. Okay. And the other thing about a pathologist doesn't care how you treat it. If you're a cardiologist, you have to say stents are the best. If you're a surgeon, you have to say surgery is the best, because otherwise all the other surgeons and people in your field will get pissed off at you. And you're going to have a hard time if you criticize the standard of your field. Okay. Whereas, pathologists, they don't care how you treat it, a pill, a diet, a surgery, whatever. They just look at it under a microscope. Gee, it's a blood clot. All right. So here's the best book on atherosclerosis, Blood Viscosity, Its Role in Cardiovascular Pathophysiology and Hematology by Gregory Sloop. He's a research genius who pioneered that, the atherothrombosis theory. Atherothrombosis encompasses all the other atherosclerosis theories. Okay, I've been studying it for over 25 years. That's the best explanation you're going to find. Okay, now here's Dr. Esselstyn's book, Prevent and Reverse Heart Disease. 99.4% no recurrent coronary cardiovascular events at 4 years. Pretty darn good results. Okay, there's nothing even remotely close to that. The so-called optimized Mediterranean diet with the Lyon study was like, he had like 32 times better results. Okay, now let's talk a little bit about diabetes. Thesis number 4. Why do doctors treat type 2 diabetes with pills that have a 0% cure rate when it can usually be cured with a low-fat vegan diet? LFV is low-fat vegan. How come the average endocrinologist has not read the basic introductory papers? I'll tell you what happened is I asked some friends of mine who are the best endocrinologists, because I wanted to talk to them and learn about it, because I was very interested in the effects of diabetes on the brain. That was sort of my main area, is the brain. And so I went and met with some renowned endocrinologists. And so I talked to them and I said, what do you think of the Sweeney paper? And they go, oh, not familiar with that. I go, how about Hemsworth paper? No, not familiar with that. How about Rabinowitz, Brownlee, Shulman? They hadn't read any of the papers. I'm like, how could you guys treat diabetes all day long every day and you don't know any of the basic landmark papers? They hadn't read any of them. And then they started saying goofy things to me. Oh, so you want to live to be 100? And I'm like, no, genius. I just think you ought to know the disease you treat every day. And basically, how did they get in their positions where they are the ones who train the fellows in endocrinology, the so-called experts in diabetes? The reason is they are experts in pharmacology. They know all the drugs backwards and forwards, all the new ones and everything, every permutation of that. but they don't know the basic disease, which is highly relevant because once you understand the basic disease, you got a better chance to cure it. For any disease, that's how you try to cure a disease. You find out what causes it, and then you figure out how can you avoid what causes it, okay? And then if you avoid what causes it, your body can often catch up and heal things, before irreversible damage happens, okay? So basically, the main thing that causes diabetes, the main cause of insulin resistance is high dietary fat, especially saturated fat. And this guy was pretty interesting here. Both of these guys are good, the Mastering Diabetes guys, okay? It's like Bobby Bitteroo, Cyrus Kumbada, something like that. And he said something kind of good. He was doing research on diabetes. He said, well, gee, in his animal studies, in order to cause diabetes in an animal, we feed them fat. So wouldn't it be logical to think that eating increased amounts of dietary fat would increase your risk of diabetes, as it actually does in real life? Yes, that is. There's more to diabetes than that. We're not going to go into all the pathophysiology of diabetes, but that's a key point. The main risk factor for diabetes is eating a high-fat diet. And you see that in populations. When they switch to eating high-fat diets, their incidence of diabetes goes up. This guy, Roy Taylor, did a great study, and he was using a couple interesting techniques. He was using nuclear magnetic resonance spectroscopy. He won the Banting Award for Best Diabetes Researcher in the World in 2012, and he was working with Gerald Shulman, who won the award in 2018. And they did two things. They worked with nuclear magnetic resonance spectroscopy, looking right at skeletal muscle. The first thing that they could find as an indicator of insulin resistance was accumulation of fat within skeletal muscle. Okay, they called it intramyocellular lipid. And then the other thing was he was looking at the liver, and you could see how much fat the liver has in it. And what he saw was that if you could get patients to lose weight, like let's say about 30 pounds, the patients who had diabetes less than 4 years, they routinely, almost all of them, reversed their diabetes, virtually all of them. All right, so that's rather astounding. So if you lose the weight and you reduce the fat in the liver, the first place you tend to lose fat out of is out of the liver because it's super metabolically active. Gee, that's good news. Something to aspire to. Okay, and the Sweeney paper, like I said, was written in the 1920s, like 1927 or something, a long time ago. It's about time the medical textbooks got updated. I can also tell you, why do medical textbooks not get updated? And here's the reason, too. Let's say you're a professor at some big name medical place. You want to get promoted. Number of publications is part of how you get promoted, get paid more money. Okay, you don't get paid at most places for writing a book chapter. Okay, so let's say the publishing company says, well, gee, Mr. Expert, can you please write a book chapter on diabetes? And the guy's thinking to himself, what a pain in the butt. I'm too busy for this stuff. He calls this fellow over there. Hey, fellow, write this chapter on diabetes, okay? The fellow goes, okay. So the fellow goes to the old book, copies the chapter, writes the new chapter. The fellow doesn't know anything, okay? And that's a big part of it. But I'm just telling you, these medical books, you read them, they're like a comedy, okay? All right, and therapeutic phlebotomy is more useful than people think. And I kind of laugh that you get better treatment results in the 1700s with therapeutic phlebotomy than a lot of these diseases get with drugs. And that's actually not a joke. Therapeutic phlebotomy has been recommended for treatment of hypertension, atherosclerosis. I'm not recommending you do that. I'm not going to go down that path, but I'm just letting you know modern medicine is so much more backward than people think. And by the way, too, I have to take that back a little bit in the sense that it's great at treating acute diseases. You know what caused it? And you can fix the problem because it's right up front. There's one issue typically. Okay. Surgical books tend to be very logical. Okay, if your goal is to do a knee replacement, follow these 100 steps and you will replace the knee joint. Okay, they're logical. How to put in a dialysis catheter, hook a patient up to dialysis. That's all logical. So surgical books are pretty logical. Radiology books are also pretty logical. Basically, you look at a film, that is an enlarged heart. That is pulmonary edema. That is pneumonia. Those are all straightforward things. But what I'm trying to say is, it's not like that with internal medicine. Internal medicine and the internal medicine subspecialties, their literature, their textbooks, to me, they're like comic books. They're so stupid, it's funny. And I'll explain some more of that as we go along. Let's see. Why do doctors treat hypertension with pills? Again, 0% chance of cure, when usually you can get, very high cure rates, especially the earlier you start with just low-fat vegan diet. Same old story. High-fat diets cause the red blood cells to stick together. That's called rouleau formation, means a stack of coins in French. Also, the chylomicrons cause the blood to sludge. Sodium, high salt, inhibits endothelial nitric oxide production. That's the key vasodilator. Okay. Here's another thing, too. This includes the most up-to-date medical books. They're going to tell you 95% of hypertension is essential, of unknown cause. Okay, and that's so stupid because we know that there's zero hypertension in populations that lifelong eat plant-based diets. They tend to have a blood pressure that really doesn't increase much from when they're born. Let's say 90/60. At most, it goes up to about 110/70, something like that if it doesn't stay lower very often. So Okay, another thing. How come surgeons don't know the most basic stuff about blood flow? I know lots of surgeons, okay, and I'm friends with lots of them. I was a surgeon in my previous life in the sense I was an imaging-guided surgeon, an interventional radiologist. I did a general surgical internship. Then I did a diagnostic radiology residency with a lot of interventional in it. And then I did an imaging-guided surgery fellowship, interventional radiology. Basically, I'd admit patients, write all the orders, and do all these procedures. Things like abscess drainages, TIPS procedure, all kinds of stuff. Okay, a lot of venous access as well. Fear of ischemia is the beginning of health wisdom, okay? Like lack of dietary fiber leads to leaky gut and abdominal pressure syndrome, okay? They don't know this stuff. I mean, because I talk to them and they don't know it. It's never been taught to them. Something as simple as Dennis Burkitt's work from the 1960s, they don't know it, and they work on the abdomen all the time. And the reason is all of these nutrition pioneers, they are not in the textbooks. I've never seen a single one in the textbooks, okay? Burkitt will be in the textbook for helping to discover Burkitt's lymphoma, but he will not be in the textbook for abdominal pressure syndrome. And abdominal pressure syndrome is approximately 1 million times more clinically important. Burkitt's lymphoma is really rare. Okay. How come vascular surgeons don't teach their patients about low-fat diet? Because they don't know it themselves is a big part of it. And isn't it obvious? Meat contains the bad stuff, excessive fat, excessive protein, excessive iron, and they're also often stuffed with anabolic estrogens and sodium and stuff. Okay, plants contain the good stuff. We talked about that. Fiber, potassium, magnesium, nitrates, antioxidants. All right, here is the Walter Kempner book. This is a very good book. Barbara Newborg is a physician who worked with him, making rounds with him every day. And she goes all through his incredible results, plus his other book publications and his scientific papers written by himself. Those are available at the Dr. McDougall website. So I would recommend you check them out if you're interested, because they're pretty interesting. And basically, he put everybody on this rice diet, which is, rice has only got 1% of calories from fat. It's got about 7% of calories from protein. So it's a low fat, low protein diet. I think they're eating a total of around 4.5% calories from protein, really low. Total percent of calories from fat was somewhere around there too. I don't know the exact percent overall, but it's probably in the ballpark of 2%. Because they also would let him have some fruits. But anyways, he had incredible results for people not only losing weight, reversing diabetes, reversing coronary artery disease, shown with reversal of EKG findings, reversal of ophthalmology, retinal exams. So it's very interesting stuff. Okay, here is the high blood pressure solution. This is the best book ever written on high blood pressure. Author's name is Richard Moore. He's an MD PhD, and for like over 50 years, he devoted his life doing research of blood pressure, especially with the emphasis on the plasma membrane ion pumps, like a vascular smooth muscle, which is what causes your arteries to constrict or to open up. And he said the most important problem, in his opinion, was a lack of dietary potassium. Remember, P for potassium, P for plants, okay? And he goes all through the epidemiology. He goes all through how the ion pumps work. It's a great book. It's a masterpiece book. Okay, how come medical schools don't teach nutrition? They really don't. And I call it NET, nutrition, epidemiology, toxicology. I remember it as NET, N-E-T. Okay, it's like the most important thing for improving health are these three things: nutrition, toxicology, epidemiology. And what I'm basically saying here is medical education is basically fake. And by that, I mean, you go to pre-med, okay, and everybody thinks pre-meds are serious students and they learn a lot. They really work them hard and, they try to weed them out, but they don't learn anything useful. Okay, I'm a triple boarded high-tech doctor. I've never used any math higher than what I knew by 4th grade. Calculus, it's irrelevant. Physics, it's irrelevant. Physical chemistry, it's irrelevant, okay? And you study organic chemistry for an entire year. You learn how to synthesize, 50 different types of paint. Well, who cares? You don't need that. You just need some basic, structure, chemical structure, functional groups to understand biochemistry. And that's really all you need from organic chemistry. You don't need a year of it. It's part of a weed out process, but I believe it's also part of a distraction process. And I even think the whole high school mathematics thing is a big joke. All these kids are distracted worrying about algebra. How many people ever use algebra, trigonometry, and calculus in their life? And they should be learning how to start a business, learning history, and all this other stuff. But anyways, that's a topic for another day. Okay. Biochemistry books, they avoid the most important things. Oh, here, I got a line here. I said, biochemistry books routinely recommend high-fat diets, things like the Mediterranean diet. And in my opinion, that is like treating a lung cancer patient with cigarettes. It's like sending a syphilis patient to a brothel for treatment. Completely stupid. They give them the same disease that caused their problem. That's like the old, typical diabetes recommended diets. They still put diabetic patients on a high-fat diet. It's totally stupid. Okay, just because a person has a degree does not mean they know what they're talking about. And I can also tell you, dietitians are not trained really in nutrition either. I know it sounds like a bizarre thing to say, but there's a lot of funding coming in from these big food companies, and they'll tell them, because I knew this dietitian. I used to chat with her when I'd go to the grocery store, and she would tell me all kinds of things. Oh, she learned that high fructose corn syrup is okay. All this glutamate MSG stuff is okay. All this stuff. I'm like, excuse me. Anyways, biochemistry books, they avoid all the toxins. That's ridiculous. You have to know these toxins to make sense of a lot of diseases. They are not in the medical school books. They are not in the biochemistry books. I learned them all from reading separate. Like, here's a funny one on mercury. There's a lady by the name of Jane Hightower. She's an internal medicine doctor in the San Francisco Bay Area. And there was all these yuppie patients becoming demented. Nobody knew what to do with them. And so they started sending them to her, and she figured out that he had to test for mercury in a different way. And they were becoming demented because they thought they want to eat more fish to be healthy. And so she just told them, stop eating fish, and their mercury levels, plummeted down. All right. And for a lot of it was reversible. Some of them it's not. The more structural damage happens, the less likely you can reverse a disease. Okay. And there's a lot of tricky little things that are in there that nobody knows about, like stevia. That increases your risk for infertility. I would never eat that stuff. Oh, the other thing, they're taught that medical students are all taught that these diseases are impossible to cure. No one knows what causes them. There is no cure. And what I'm saying is they're basically trained in learned helplessness. They're trained that there's nothing you could do. All right. And then the other thing that happens to a doctor is when you work in a hospital, you're under pressure. There's always a bean counter saying, come on, come on, come on. Average number of patients seen in this clinic is, 25 a day, 30 a day. And so if you're not seeing your 30 patients a day, they're going to be on your case. How come you're not pulling your weight? So-and-so is bringing in so much money. How come you're not bringing in more money? We're going to have to let you go if you don't start seeing at least 30 patients a day. So they don't have any time to sit there and talk about nutrition and health and disease causation and prevention because they could get fired and lose their job. Plus, the standard of care is written that they must prescribe this pill for the patient's, blood pressure in this range or blood glucose in this range. So there's no financial reason for them to do it. And as a matter of fact, they're punished if they try to help the patient. Okay, because what tends to happen is most modern clinics, hospitals, all these medical centers in the Western world, they just assume the standard of care is where it's at, and they insist on it. Whatever happens to the patient don't matter. If the patient dies, so what? They can't get sued because they followed the standard of care. But here's the big, monkey wrench in the whole thing is that quite often there's a standard of care right here, but there could be an optimal care. And what you really want is optimal care. But the truth of the matter is they assume the patient is a complete idiot, incapable of anything. It's essentially like veterinary medicine, that the patient is not going to change anything except take their pill or have somebody give them their pill. And what I'm trying to say is for an intelligent, motivated person, if they're willing to change their diet, change their exercise, get more sleep, et cetera, they quite often can reverse a lot of these diseases, but they have to be motivated. But it does make sense to have a standard of care based on the lowest common denominator, because I can tell you, lots of patients are really mentally slow with no curiosity, and it's kind of sad and hopeless. And I can also tell you that's why doctors behave the way they do. You ever go talk to a doctor, they're always like, hello, nice to meet you, kind of like this dopey, polite, professional, personal manner. And the reason they're like that is they're talking to demented, not demented, but cognitively slow people all day long. So they have to be that way until proven otherwise. So you ever go to the doctor, dress really nice and sharp, because then immediately everybody will say, oh, this is an educated person. This is a person who knows what's going on, et cetera, et cetera. I'm just telling you, it's true. You'll see that as a case. It's just a fact of how it is. But what I'm trying to say is look at allopathic medicine. They basically say for all the chronic diseases, which are very, very common, they're the most common diseases, they say, we are the best. We are the standard allopathic medicine, even though we never cure a single patient. I mean, it's ridiculous. We always lose. We're the best. It would be like a sports team. Could you imagine having a sports team that said, we're the best. We lose every game. Yay, we lost again. You guys suck, okay? Let's see. All right, so now here, thesis number 8. This one is about autoimmune disease. Again, they treat them with very powerful pills, very much like chemotherapy, that have a 0% cure rate. And often you can cure a lot of these autoimmune diseases simply by preventing leaky gut, which you get from the fiber, a low-fat vegan diet, and you avoid a lot of toxins, things like, GP, glyphosate, spraying on the soy, and other non-organic foods, some of them, F- in the water, you can filter that out, etc. Al is also another thing that causes leaky gut. Okay, so then you read the Ivy League pathology books, and I have a recent edition, 5 years ago, the big standard pathology book, about 2,000 pages. It doesn't even mention leaky gut in the chapter on autoimmune disease. That's ridiculous. Like I said, that would be like a basketball player who doesn't know how to dribble. That would be like a baseball player who doesn't throw and catch. I mean, come on. It's the most important thing in the whole field, and it's not in the chapter. It's ridiculous, okay? So here's a book, What's Missing from Medicine by Sari Stanchik. She was diagnosed with multiple sclerosis, and she was able to reverse it and control it or prevent it from progressing by, eating a vegan diet. And she talks all about that. And she noticed the way she kind of figured it out too was she looked at twin studies and she said, well, gee, identical twins don't always get it. If they got identical genes, then it's not genetic. Okay. So that was pretty useful. And she saw, gosh, a lot of good information in the nutrition literature. Okay, another thing is most medical centers, they recommend the Mediterranean diet. And in my opinion, the Mediterranean diet is totally stupid. It meant something more back in the 1950s in the days of Ansel Keys when it was primarily a plant-based diet. But nowadays, it's just an excuse to eat meat, olive oil, cheese, wine, all these high-fat foods, nuts, seeds, canola oil, all this stuff. Okay, and there's a lot of people that sort of, let's say you have a doctor who really doesn't know anything about nutrition. They sort of sense, well, gee, the safe thing to say is Mediterranean. Oh, I think the Mediterranean diet is the best diet. Oh, really? Why do you think that? And you'll find that usually they haven't read anything about it. They don't even know what they're talking about. It means that they're an ignoramus, okay? Mediterranean diet also allows alcohol, caffeine, dairy. It almost doesn't forbid anything. All right, and so I call Mediterranean diet the antichrist of diets because it promises salvation but leads them into health hell. Okay, here's a head trauma patient, frontal lobe contusion right there. That's a focal bleed in the frontal lobes. And you'll get them because you hit your head, and you can also get acceleration, deceleration problems here. So a common spot for these contusions is right here in the inferior frontal lobe, also in the anterior temporal lobe. And those are important spots. This is a big part of your personality, your value judgments and whatnot. So head trauma is a big deal. You want to avoid it, okay? Avoid anything with head trauma. Another secret, a lot of people don't know this. I think soccer is kind of a stupid sport, okay? People go, oh, no, soccer is the greatest thing. All these soccer moms driving around their Volkswagen, taking their kids to soccer practice. No, the kid sits there in front of the goal, and the coach, a big grown man, kicks a ball at the kid's head. It's like volunteering to be punched in the head. It can cause brain damage. I've seen plenty of cases of that. Okay, why does adult psychiatry prescribe drugs that barely ever cure anyone, but they have lots of side effects? Dr. Bragan, he's the greatest psychiatrist who ever lived, in my opinion. My father was a psychiatrist, and I consider going into psychiatry. I've read quite a lot about it. Plus, I'm a brain doctor is my main current field, and working in neuroradiology. I do other things too, but that's my main thing. And most of these drugs, they cause a slowly progressive equivalent of a lobotomy. It's a chemical lobotomy. All right. And here's another book. It's not just Bragan. It's everybody who studied neuropsychopharmacology. Drug-Induced Dementia, A Perfect Crime by Grace Jackson. So you go to psychiatrists, you can take your pick. Would you like dementia induced by a drug? Would you prefer a lobotomy induced by electroshock? Or would you prefer a lobotomy induced by open surgical procedure? What a great set of choices. Okay. There's more to it than that, but psychiatry is one of the most overrated fields in medicine. You'll be amazed at how toxic those drugs are. The brain's not that simple. It's not 2 + 2 = 4. The brain's like this complex symphony of things happening simultaneously. And our ability to fix that by throwing a drug at it is much. Prostate cancers. This Dean Ornish did a really good research paper where it's about 98 biopsy-proven prostate cancers, went into what's called watchful waiting. They had denied, surgery, radiation, chemo, and then they would just follow their PSA, the blood test, prostate-specific antigen. And the ones who, ate a vegetarian diet, and they had a couple other minor health things in there, but along those lines, tried to lower their stress a little bit. They kept their PSA stable or decreased them, and they did not need to go on to open surgery or radiation or chemo. So that sounds good. Okay. China study was the work of T. Colin Campbell, and he basically found that eating increased amounts of animal protein dramatically increased the risk of cancer progression. Okay. Also, a lot of guys are impotent. You can go by the decade by that percent number. What I mean by that is about 30% in their 30s, 40% in their 40s, 50% in their 50s, 60% in their 60s. There's really a little more than that, I think, from what I've seen. And nobody even tells them that low-fat vegan could eventually prevent that. Okay, nephrologists. Nephrologists take care of kidney patients, and almost none of them knows anything about nutrition. And it's pretty simple. The main thing the kidney does is it excretes nitrogen. So, the only thing that's got nitrogen in it is protein. There's no nitrogen in fats and in carbohydrates. So, if you reduce your protein intake, guess what? You reduce the workload on your kidneys, and then maybe they'll have a chance to heal a little bit, and they'll be able to use their resources to filter all the toxins out of the blood and keep the patient off of dialysis. Wouldn't that be nice? And so here's this guy named Lee Hull. He's a real smart guy. He's not a doctor. He's not a healthcare person, but he's a smart guy, and he just researched it all on his own, and he wrote the best book written on stopping kidney disease. So how come the best book written on how to stop kidney disease is written by a non-healthcare provider. Okay, he did it because he wanted to save his own life, and he did. But what I'm saying is, the least the doctors could do is read the guy's book. And of course, a lot of patients won't follow the diet. Fine, but then it's the patient's fault for not following the diet. It's not your fault for being an ignoramus. Okay. Okay, now we're going to talk about pediatric psychiatry, which is another disaster. Okay, you know, they're giving amphetamines, these little kids who are labeled with attention deficit because their teacher thinks they're annoying. Okay, and you know, you can't sell amphetamines legally to an adult on a street corner, but you think it's okay to give that to a kid. Those things are all excitotoxins. Okay, they cause brain damage. Okay, a lot of times they're turning these kids into polypharmacy psych patients. All right. And I'm sure it has nothing to do with money. What I'm trying to say is, if there was no money involved, I don't think any kid would be getting these drugs. Okay. So here's Mark Antony giving the funeral oration for Julius Caesar. And here we go. Friends, Romans, countrymen, lend me your ears. I come to bury children, not to praise them. The noble psychiatrists have told you that amphetamines are good for children and that psychiatrists are honorable men. You all did love children once. And to mourn for them. O judgment, thou art fled the brutish beast, and men have lost their reason. Bear with me. My heart is in the coffin with these children, and I must pause till it come back to me. It's BS, okay? These children are being poisoned, and nobody cares or does anything about it. It's a disgrace. When somebody looks back on our society, says, look what these assholes did. They poisoned children. They will have disgusted our society. It's disgusting. It's evil, all right? And this is what I'm saying, why you have to have the ethics of the individual patient is the most important thing. Ayn Rand had written, the smallest minority is the individual. If you guarantee individual rights, all the other rights follow from that. And that's what I'm also saying. There's always going to be big money and ripping people off and selling them drugs. So you have to, in a sense, love the person and say, I will do what is right for you, and I don't care if I make less money that way. And if you're not willing to say that, you end up with bad things happening to the patient. Okay. Here's a good book, Anatomy of an Epidemic by Robert Whitaker. And he goes through pretty extensively all the massive side effects. They're much worse than people widely know. Okay. A little bit here. Pediatricians give toxic drugs to kids that cause more harm than good. They don't even know what they're doing. For example, a real common thing, give kids tons of Tylenol. Well, do you ever look at Tylenol? It's a liver toxin. It's a mitochondrial toxin. You know, there are times when it's reasonable, but it should not be given as routinely and easily as it should, as well as a bunch of other things. Okay, why do cancer doctors often give chemotherapy, even when they know the patient's unlikely to benefit? Are they just assuming the patient's already dead, so they might as well try the latest drug in fashion? You'd be surprised how common that is. The kind of attitude is, well, this guy's going to die anyways. Let's just try this drug. You know, maybe it'll work. And that might sound reasonable until you say to yourself, well, gee, if I only had a couple months left to live, I would like to spend it, you know, with my family or doing my hobby. I wouldn't want to spend it, you know, vomiting and sick. Okay, why do so many long-term survivors of cancer say the key was to eat more low-fat, sleep more, exercise more, and follow their religion more? It lowers their stress level. Okay, so here's a couple interesting people. This lady here, Janet Murray Wakeland, she had metastatic breast cancer, and she decided to go raw vegan. She wrote a book called Raw Cures Cancer. All right, and she did something extraordinary. She ran a marathon every day of the year, 365 in a row, around the perimeter of Australia. Okay. She's alive, I know, like at least 20 years later after being diagnosed with metastatic breast cancer. And they tell these patients, make a will, you're dead in 6 months, okay? And here's another lady, same thing. This is Ruth Heidrich. She was about 42 years of age and she was diagnosed with breast cancer. And she was told the same thing. You got about 6 months, you know, make a will. And she's like, no, I want to run a marathon. So she ended up running marathons and triathlons. She's still alive. She's doing real well. I mean, mentally, she's real sharp. She's in her late 80s, okay? And here's this lady here. Her name is Kelly Turner, and she was working in one of these famous cancer centers out east. And she had some patient come in who had long-term survival of metastatic cancer. Everybody thought the patient was going to die. So that's sort of a radical. Well, Lee, what did you do? She started studying the patient. And then when she went to the oncologist at her cancer center, none of them really cared. And she also noticed nobody really seemed to have any interest in these people who had long survival of metastatic cancer. And she's like, how come you aren't interested? And sort of like, you don't make any money off them. So what? Okay, it's not going to apply to somebody else. Maybe they just got lucky. Spontaneous remission from luck. Okay, so the big thing with breast cancer, for example. And so anyway, she studied it all. She drove around, interviewed them all, interviewed as many as she could. And she wrote a book about a radical remission. It's a very good book. Okay. And by the way, all these people I'm showing you these books, there's videos about all this stuff on the internet. You don't have to buy these books unless you want to. You just go on the internet and watch videos of these people. I'm showing you these people so you know where to get good information fast. And then you can branch out from there and learn other things, whatever you want. But I'm just letting you know very useful information is present about many of these subjects. And none of this is in the medical books. No doctor knows these things from their medical education. If they learned about it, it's because they sought this information on their own. And this typical thing you see with breast cancer is they got the pink ribbon and the women are sad. Their friends got breast cancer. So they all walk around saying, we're raising money for breast cancer. And they really mean well. You know, their heart's in the right place. But what I'm trying to say is, again, it's kind of a joke, okay? They're giving money to the chemo company, okay? Nobody teaches these poor women about breast cancer, and a lot of it's pretty basic, okay? You know, like let's say here's your armpit, okay? Your armpit has shared lymphatics with the upper outer quadrant of the breast. Typical deodorant is aluminum. Aluminum blocks the pores to cause decreased sweat. That's how it works. Well, guess what? Aluminum is a metalloestrogen. It increases proliferation of your breast ductal cells. So you're putting a carcinogen right in your armpit every day. Okay. And then it typically has a pyrobenzoic acid preservatives, which is another estrogen-like toxic chemical, estrogenic chemical. You're putting it right into the lymphatics that are shared with the upper outer quadrant. Incidence upper outer quadrant breast cancer used to be about 30% in the 1920s. Now it's like 60%. Okay. So it's stupid. You don't know any better. And what do a lot of women do? Some guys too, perhaps, they shave their armpit, and that increases transdermal absorption. So that's one cancer risk. Then their tap water is full of estrogenic chemicals. They don't know it. You can remove them just with a carbon filter. And so they're ingesting all these estrogenic chemicals that way. Then they eat a meat and oil diet, so they get a different type of gut flora. There's only two types of gut flora you need to know about, the good one and the bad one. The bad one, like from a meat processed food diet, tends to have more of an enzyme called glucuronidase. And what that means is your body, to excrete estrogen, the liver conjugates with something called glucuronic acid, then pushes it into the bile, and then you defecate that out of your system. That's what normally should happen. But if you have a lack of dietary fiber, then you get the bad gut bacteria. Good gut bacteria feed on fiber. Bad gut bacteria, which accumulate in the absence of the fiber, they have more glucuronidase enzyme. So they cut the conjugation. They cleave the glucuronic acid from the estrogen. So now the estrogen, without the glucuronic acid bound to it, it's reabsorbed into the body. So they have estrogen levels up off the chart. I've known women who tell me, they say, Dr. Rogers, every woman in my family had to get a hysterectomy before she was, 30 or 35. Meat, they're all deficient in fiber and they're all wearing deodorant, okay? Plus all these personal care products, they're full of estrogenic chemicals, okay? Because estrogenic chemicals are good preservatives. They're antimicrobial. They prevent fungal growth. So they're in like everything, all right? That's why you want to use a minimum of personal care products is another way to reduce your risk of breast cancer, okay? Ophthalmologist. You'll never meet one who knows Kempner and knows all how Kempner reversed so many retinopathies. Okay, now we're going to talk, dermatologists, they all say, you need to wear sunscreen and this and that. And yeah, right. I never wear sunscreen. I'm scared of all the chemicals in there. There's a bunch of estrogenic chemicals. There's nanoparticles in there. I don't know how much of that can potentially be absorbed through my skin and potentially cross my blood-brain barrier. No, thank you. If I want a little sunshine, I'll walk out in front of the house and I'll just be like a solar panel and collect a little sun. Then my wife will yell at me, "You're lowering the property value." But anyways, number 19, how come neurologists do not put multiple sclerosis patients on the Roy Swank diet? He's got the best results of anybody in the world. He's got 50-year follow-up. Okay, at 34 years, like 90+% of the patients were still able to perform their activities of daily living, their ADLs, all right? Nobody's even close to that, okay? And he did a lot of research on blood flow, okay? There's a really good video done by Swank, but it's on the Dr. McDougall YouTube channel of high-fat meal, blood sludge, and it's only 50 seconds long. And what you basically see is after the high-fat meal, the red blood cells all start sticking together, like I referred to earlier, the concept of blood sludge, rouleau formation. The chylomicrons are sticking them together. And the thicker the blood, the harder the heart has to pump. And what that means is blood pressure goes up. The purpose of blood pressure is to get blood to the top of your brain, because that's going against gravity, is to pump to the top of your brain. All right, so think about it. If you're pumping, normal blood, kind of like water, relatively easy. But if you're pumping thick blood, like a milkshake, so to speak, you need a lot of pressure to get that blood to the top of the brain, okay? And then worse, you throw some salt in there and you constrict all the arteries so they're all tight. Now you got to pump through a tight system to get the same amount of blood to the brain. Pressure's got to go up, up, up. And that chronic high blood pressure damages the blood vessels, which leads down over time to more atherosclerosis, calcified arteries, etc. Okay, how come neurologists don't know almost anything about toxicology? I know them because I'm friends with a bunch of neurologists. I talk to them all the time. I know exactly what they know and what they don't know. They don't know this stuff. It's not in their book. So, I bought the big Ivy League 1,700-page neurology textbook. It's a joke, okay? It's so stupid, it's not even funny. First of all, it's totally weak on all these toxicology things. And I think I've talked about Alzheimer's before, but Alzheimer's is stupid. You can't diagnose Alzheimer's by historical question, by physical exam, by blood test, by imaging is not well diagnosed. I'm a neuroradiologist. I look at these things all the time. They say theoretically, well, you have focal atrophy of the temporal lobes and the parietal lobes. Yeah, BS. I almost never see that, okay? So what I'm saying, and then even the so-called nuclear medicine, well, we're going to do, an amyloid scan. It's not that good. Even at autopsy, they can't effectively diagnose it if they don't have the previous history, because normal patients will look like it and abnormal patients will sometimes, and the patient who supposedly has it clinically doesn't have it either. So it's not reliable. And that's what I'm saying. And then they don't have any good treatments for it either. So that sounds like BS to me. You can't diagnose it and you can't treat it. Sounds like BS, okay? But you can sell a drug and make money. All right. If you want to learn something about dementia, the best book to start with would be Alzheimer's Turning Point by Jack Delatorre. Again, typical situation. He's not in any of the books. The guy deserves a Nobel Prize, but nobody knows about him. And I talked about him in previous lectures. I'm not going down that path too much right now, but trust me, the Alzheimer's Turning Point, the vascular hypothesis of dementia, I call it the mouse equivalent theory. It's very useful conceptually to get that. Once you get that, a lot of other things will make sense. Excitotoxins. He wrote a pioneering book here back in 1997. It's Dr. Blalock. It's a good book, okay? MS, here's Swank's book. This other guy wrote a really nice book here. And this guy's a physicist, and he's a little bit of a biologist as well, but he's primarily a physicist. And he went through a lot of stuff on neurophysiology, about what's making people demented. And the bottom line is you don't want to do things that open up voltage-gated calcium channels. And guess what? Putting a cell phone in your head opens up voltage-gated calcium channels. You don't want to be doing that. He goes through a whole bunch of other things, but he doesn't know anything about nutrition. I'll just leave it at that. What I'm sort of doing is whetting your appetite, depending on your curiosity and your interest level. These are some big time things. And again, the point I'm making is all of the good stuff is not in the books, and all of the nonsense about we don't know what's going on, give the patient a drug. That's all that's in the books. Okay. And there's my theory about dementia, the neurovascular uncoupling theory. So if you're interested in brain function, I actually think my theory is the best one, but I'm not going to talk about it too much now. But if you're interested, it'll be there. Okay. I spent tons of time figuring out dementia. Okay. Number 20, thesis number 20. How come infectious disease attendings, an attending is a doctor who's completed residency and fellowship, they don't know anything about postprandial endotoxemia? And that's a pretty important thing. It affects blood clotting, and it can long-term lead to cardiac dysfunction, and long-term can lead to cognitive dysfunction. And so trust me, if you're serious about understanding disease, including infectious diseases, modern common diseases, you want to know about postprandial bacterial endotoxemia. These two right here, Rhizia praetoris, this lady scientist from South Africa, and this gentleman here, Douglas Kell, from England, are both geniuses, and they have figured out a lot of very useful stuff. And you're going to get into concepts of things like amyloidogenic blood clotting. It's very useful to know this, okay? Because, again, once you understand blood clotting is what leads to worsening atherosclerosis, which plugs up the arteries to your brain, your heart, your Johnson, you want to avoid these things. People think about bleeding. Bleeding is in the movies, okay? In real life, people die by far primarily due to blood clotting. They clot up an artery in the heart. That's a heart attack. They clot up an artery in the brain. That's a stroke. So you don't want to be doing things that predispose your blood to clot unnecessarily. So that's why, the high-fat meal thickens your blood. I don't like it. The sodium's contracting your vessels. I don't like it. Okay, and it's inhibiting your endothelial nitric oxide. So you're losing the effect on your platelets. You have an anti-platelet effect normally that you lose. So it makes your blood more thrombotic. All right. Being stressed out also raises your fibrinogen level. When you have leaky gut, the bacteria release their endotoxin called lipopolysaccharide for the gram-negative bacteria, lipoteichoic acid for the gram-positive bacteria, so that's LPS or LTA, and that gets into the blood, and it changes the shape of the blood clotting protein fibrinogen. Basically, it switches from being an alpha helix to being a beta pleated sheet, goes from being round and cylindrical to being flat, and then they stack up and they create these big aggregates, sometimes called dense matted deposits. So all I'm saying is it makes the blood thrombotic. You don't want it because that predisposes you to higher risk of dementia and heart attack. All right, so that's another reason why you want to prevent leaky gut. It's not just about preventing autoimmune disease. It's also about preventing, making your blood less thrombotic and also helping your immune system to function. Okay, how come orthopedic doctors know so little about the low-fat, low-sodium vegan diet? Yeah, all these fat patients are always going for joint replacements. And I've known some pretty nice people who've died from joint replacements or who have had multiple episodes of septic shock and stuff. And don't get me wrong, most joint replacements work pretty well. Okay, the orthopods, they know what they're doing, and that's all good. But what I'm saying is if you could fix the problem by just eating some starch, that would be preferable to, having a big major surgery, don't you think? Okay. How come obstetric doctors really don't know much about estrogenic chemistry? Like my wife was friends with this OB-GYN doctor. She goes, oh, she's so smart. She knows more than you. Wait till you see how smart this lady is, all these degrees and all this stuff. I said, okay, fine. I'll be happy to meet her. Okay. So I meet her. I start talking to her. What about this estrogenic chemical? What about this estrogenic chemical? She didn't know them, okay? Because there's certain things they have to know about how to deliver a baby, how to replace estrogen perhaps in a postmenopausal women. But in terms of the pathophysiology related to cancer and obesity, she didn't know it. And so what I'm trying to say is she's like the smartest OB-GYN doctor, okay? My wife knows a lot of doctors. So they don't know it, okay? I don't talk to OB-GYNs that much, but all right. Anyways, and I do remember my old days when I rotated through OB-GYN surgery. Okay, so this book is the best book ever written on estrogenic chemicals. This guy, Anthony J, is a very clever guy. He's a lipid biochemist. He doesn't know much about food. He's kind of young. Young guys also, they're kind of macho. They think they got to eat animals to be big and strong. But if you want to learn about estrogen chemistry fast, that's the best book ever written. He has good videos on that as well. There's other good books, okay, like Philippa Darbra. She's a PhD scientist in England who's done a lot of pioneering work on the risk of deodorant and breast cancer. Her book is good, but it's more of a textbook. It's more dry, and it's more comprehensive, whereas this hits all the main points fast. It's a great book. It's one of the best medical books ever written. Okay, how come opioids are pushed so heavily? Tons and tons of opioids coming into this country and making people sick. I've personally known a bunch of healthcare workers who've lost a family member from these opioids. That's why you don't want to take these drugs. I had to go for a colonoscopy many, many years ago because my mom died of colon cancer. And gosh, this was like about almost 30 years ago, at least 25 years ago. And I refused sedation because I figured that way I could drive myself home. So all my family's making fun of me. Oh, you enjoyed the colonoscopy. That's why you didn't want sedation. I'm like, no, genius. I just didn't want to risk the side effects. And the other drugs they give, the benzodiazepines, they can affect your memory. I was afraid of having a long-term cognitive deficit from that. So that's why I didn't do it. But I never went back for colonoscopy because I started reading about it. I'm like, gee, a lot of people have reversed their polyps by just eating a healthy diet, and your risk of colon cancer if you eat a low-fat vegan diet is next to nothing. So then the risk of complications of colonoscopy become higher than the benefits, the potential benefits. So, like a perforation, bleeding from a biopsy site, et cetera. Okay, how come nutrition, epidemiology, toxicology, net are not taught? And I wonder, somebody behind the scenes like Big Food, Big Pharma, Big Protein, hiding the truth from the healthcare providers. So like nobody knows the story of Burkitt. I mean, real basic stuff is abdominal pressure syndrome. Every single doctor should know that backwards and forward, but none of them do. I've never met a single one because it's just kind of a little game I play. My life's pretty boring, okay? So when I get some medical student, resident, or other attending tagging around behind me, I always ask them, what do you think about abdominal pressure syndrome? What do you think about, all this stuff we talk about today? They never know any question. They never get a single one. I tell them, don't be embarrassed. No one ever knows the answer to these questions. Okay, the other thing too is they'll tell me, oh, Pete, it's so great. You know all this stuff. I had medical students thank me so much because I even tell them when a medical student comes up to me, I said, okay, I'm going to start out by I'm going to read your mind. Okay, do you believe I can read your mind? I can read your mind. I guarantee it. I go, first of all, you've worked really hard. You've been a good boy for 8 years. You did what you're supposed to. You did your work. But deep down inside, you feel like a phony, like a fake, like an imposter, that you don't know the cause of any of the diseases and how to treat them. Is that true? And they go, yeah. And then I always tell them, in 2 hours, you're going to learn more than you have learned in the last 8 years. And they all smile like I'm full of BS. But by the end, they always go, wow. And then they won't fully admit it, but they say, a couple of them said to me, we want a refund from our medical school because they know it's true. That's what's kind of funny about it. And I think part of the reason they keep it secret is because if they told the truth, then, you'd lose a lot of money, the medical system. Okay. The medical system, it makes money selling drugs. All right. All right, and this is what I said. Ayn Rand, she wrote in her book, The Smallest Minority is the Individual. This is a great book. If you want to understand art, all of that stuff is the best stuff. And what I'm trying to say is until the medical system accepts the ethics of the patient, the person, the individual is the most important thing, it's always going to stink because you can, like I'm repeating myself here, but you can always make a lot more money ripping people off, selling them drugs or cutting them open with a surgery. That's where the money is. And, the insurance companies are in on the game too because they don't reimburse you for talking to the patient. And the entire clinical system, the way it's set up, you got to go faster, 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 faster. You can't be talking to a person, empowering them to go faster. And that's why it has to come from outside. And what I'm saying is, until you go down that path of these types of ethics, okay, here is Ayn Rand, another quote from her. Art is the concretization of metaphysics. And what I basically mean by that is all of this good stuff comes from valuing the individual, valuing human life. When you go down the path of atheistic Darwinism, which is how evolutionary biology is taught, for example, you basically say people are nothing. They are just talking monkeys. They have no soul. They have no rights. You have no obligation to them. I'm not obligated to a talking monkey. Monkeys are in the zoo, okay? And that's the culture our society has accepted, and it has consequences. And I'm going to show you what I mean by those consequences, and they filter over into healthcare and then into a bunch of other things too. Okay, this is the Pietà made by Michelangelo, the greatest statue ever made, all right, around 1500. Okay, here's a beautiful thing from Jean Valjean and Les Miserables by Victor Hugo. So this is beautiful art, compassionate, redemptive, okay? Here's modern art. Statues of feces, of turds, all right? And what I'm saying is, imagine you were alive during the time of the Renaissance and you had a special future travel machine and you came to the modern world and you go to their art museum. So you remember the Renaissance art museum where you saw the Michelangelo and the other great artists, Raphael and the other ones, and you come to the modern world and you see a bunch of statues of feces. You would say these people are disgusting, they're stupid, they're evil, okay? And what I'm trying to tell you, that is the metaphysics of modern culture. All these modern art museums with things that are not much better than this, I think they use them to launder money. They look like a child could have done it. And what I'm trying to tell you is, if the morality of your society goes to atheism, you end up with statue of turds in your museums. And if you think it's a joke, it's not a joke when that is sort of the measure of your society and that mentality is transferred into healthcare. Okay, when you think that way, why help the patient? Who cares about the patient? They're just a talking monkey if you have an atheistic Darwin viewpoint. And I'm telling you, it has major consequences. You think it doesn't, but it does, okay? When you have a love of God and mankind, it leads you to loving them, wanting to help them. It puts your heart in the right place to do the right thing, even if it means you go home late, even if it means you make less money. On the other hand, back in France in 1790, it wasn't just a rejection of the king. It was a rejection of God. And when they went down that path, then you run into where individual lives, they're meaningless, okay? The ruler becomes like a god, and it leads to this type of stuff, okay? It's not good. And people think that's a joke, but I'm telling you, until you medicine stinks and it rips off people and it poisons them, is because it does not value the individual. All right. And, people don't like that. Go, oh, well, why are you talking about religion, or why are you talking about morals and values and philosophy? I'm like, because you have to. If you don't value the individual, and valuing the individual tends to come from that stuff, you're always going to rip off and hurt people. And there's no way around that. No medical, surgical bullshitology or high tech can change that. It's always going to be far more profitable to pump people full of drugs and rip them off with unnecessary imaging tests and surgeries than it is to empower them with education. If you look at coronary artery disease, the system gets money for every day if it puts a patient on drugs. It's like I said, milking a cow. You put a stent in, $30,000, okay? It's a lot of money. You do open heart surgery, coronary bypass graft, a cabbage, you get $120,000, $150,000. What do you get for teaching a patient about vegan diet? Nothing, maybe $1,000. You bring them in for a day, maybe a couple thousand for a weekend. So what I'm saying is, if you are running a hospital, whoever owns the hospital or whatever, the more money that hospital makes, the more profit you get for yourself, for the hospital. So the total incentive is build them as much as possible. And I also tell the story where when I was a new doc, I went to a private practice hospital initially, even though I belong at a research hospital, because my mom was sick and it was where I could get a job close to home and near my father at that time. So what happened, though, was I had a case that I shared with a cardiologist. I was an interventional radiologist, mostly vascular interventional. And the cardiologist, in my opinion, screwed up the case. So I told my radiology coworker, I go, man, this cardiologist, he's an idiot. He screwed up this case. He mismanaged this problem. And I think we could have gotten a much better outcome. And the other doc goes, oh, no, you can't ever say that again. I go, what are you talking about? And he goes, you don't understand. He's the biggest rainmaker for this hospital. He brings more money than anybody, okay? Administration loves him. You can never criticize him. And I'm like, holy crap. The definition of the best doctor in a private practice setting is whatever doctor brings in the most money. So the bean counters are happy with them. And what I'm trying to say is, in a pure research situation, the person who writes the most papers is the best doctor, okay? But what I would think is kind of like how a patient thinks. The best doctor is the one who cures you, who cures the most patients, but that's actually irrelevant. Whether or not the patient is cured in conventional medicine is irrelevant. They're simply, like a statistic, and everyone says standard of care, which sounds scientific, but in reality, it's a lowest common denominator. Quite often, there's an optimal care that's better. And the reason why standard care dominates is because you get paid for it, number one. Number two, it's usually really fast. And number three, you can't be sued. You offer the standard of care. So whatever happens to the patient, they're irrelevant. That's why I joke. Patients are irrelevant. No one cares about them. I've never seen a single hospital in my entire life that actually follows outcomes on a routine basis. Okay. Maybe some individual does for a research study, but no hospital ever follows it. Why is that? Let's say for these chronic diseases, because if they followed the outcomes and somebody started to compete based on outcomes, somebody would go low-fat vegan and they would have the best results by far. So therefore, they never want anything going down that path of following outcomes. But, if you're a sports team, you look at the record. How much does the team win? How many, how well do the best athletes do? How many points do they score? How many home runs? Whatever. There's some way to measure progress and success. Whereas in clinical medicine, there usually is no way to know. No one's keeping track. Oh, well, we followed the standard of care. What are you going to do? What are you going to do? All right. So here's Martin Luther. And what had happened was after his 95 Theses, and he wrote a little more about it, the Pope sent him a letter saying, called the Papal Bulletin, Papal Bull, telling him to recant what he had said. Martin Luther refused, and he took it and he burned the Papal Bulletin. Okay, the Papal Bull. And this is a pretty famous painting. There's a whole bunch of paintings about this. I'm just showing you two of them. Okay. And so I thought the same about the physician desk reference, the drug dealing manual, and the DSM, like a diagnosis and statistical manual of psychiatry. And so I got my monk uniform on here today, by the way, in case you didn't notice. I got my monk haircut too, by the way, a tonsure. All right. So I threw them in the fire as a symbolic gesture. Patients deserve better than this. Don't get me wrong. There can be some useful information in the PDR, and I'm kind of exaggerating the situation, but I think you get the point. Drugs are not the center of the health world, okay? Copernicus here in this beautiful painting by Jan Matejko, he basically had showed that, the earth wasn't in the center of the universe, the sun was. All right. Now, what I'm trying to say is the center of the health universe should not be drugs. It should be, sort of God's way of healing, if you want to call it that, but nutrition, toxicology. That gets the best results, and everybody should know that stuff that's taking care of patients, as well as the other things, getting your sleep, managing your stress, all that other psychological stuff. Okay, the center of the optimal health universe is not drugs. And so I kind of joke here, instead of being in this universe, you want to be in this universe as much as possible. All these things: sunshine, laughter, friendship, social support, appreciation of good art and music. All those things make you happier and healthier, lower your stress level, improve your blood flow, etc. Okay, versus, mass yielded a pill and send a bill. And that's why I joke. You could take a health coach. Anybody who decides they want to learn about nutrition and health, and in a month, in a week, they can learn more than a doctor learns in 12 or 14 years. And it's just a fact. I know this from speaking to tons and tons of doctors. And the other thing I'll tell you too, is lots of doctors, they tell me, "Oh, Pete, you're so smart. Thanks for showing us. Thanks for helping me." I got lots of doctors that come to me for advice about all kinds of things. And what I'm joking about is they never, ever invite me to go speak in front of their medical groups. And it's obvious why. They know if I sit there and tell people, "Gee, you can cure atherosclerosis or hypertension with a diet," that would not go well with their hospital administrator who's counting the beans. All right. And all hospitals have to make money. They're a business entity. And so if somebody's talking about this nutrition nonsense taken away from profits, they're going to go, get that out of here. They're not going to like it. So that's what I'm saying is they know the reality of the situation is that nobody wants this nutrition stuff. And here's how a hospital works. Basically, you've got at the bottom level, the majority of the employees are things like clerks and secretaries, either no degree, no college degree, or 2-year degree or something, a technologist or something. And the transporters, the greeters, they love the patients. Many of them are patients themselves. They have family members who are patients. They are one with the patient, okay? And they're very nice to the patients, and that's all good. Doctors are like, and a lot of the other healthcare providers are basically narrow expertise persons. There's almost nobody in a hospital who really has a comprehensive view of health and all this stuff. And it took me a long time to acquire it, okay? But it's rare, okay, that somebody actually has a big picture understanding of what's going on. And what I'm trying to say is they went into healthcare because they wanted to help the patient. They were good students, but they're very narrow. And like I said, the pressure on them is to play it safe, be a conformist, go with the standard of care, get the patients in and out as fast as possible, like an assembly line. There's always going to be some bean counter at the top of any big medical entity that's cracking the whip saying faster, 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 you know? Okay, hospital owners. Now, the hospital owners, a lot of them have an MBA, and some of them know more, but some of them are doctors, some are not. But again, they always emphasize the productivity markers. How many billing codes did we generate such and such a month? And they also often have somebody above them who like maybe owns the hospital or whatever, or, you know, and they have to please them. Okay. And that person wants money. Okay. And then there's big pharma at the top, and big pharma could care less about the people. Big pharma wants to sell its drugs, and it does not care what the person suffer from. And, you know, you say to yourself, who would do such a thing? You know what I'm saying? Is imagine that somebody, the reason I'm going through this is they poison children all the time, big pharma. And what I'm saying is, imagine someone asked you, any normal person would refuse to do it. If somebody said, would you poison a kid? And what I'm saying is, even if you hated everything about the kid, hated everything about their family, et cetera, et cetera, et cetera, you wouldn't do it. You go, that's wrong. I wouldn't do that. What I'm saying is big pharma does it all day long, every day. Okay. And pediatric psychiatry does it every day. And it's just considered normal. Business is normal. And then the people who actually know something about it, like I know about it, what's going on. And Thomas Schaas recognized this back in the 1960s. He said giving psychiatric drugs to children is poisoning them. Okay. This has been known a long time. And so what I'm saying is, but it goes on every day. You know, I'm at least teaching people about it. You know, the poor parents, you know, their kid gets labeled, you know, attention deficit or something by a teacher, and all of a sudden the kid's getting drugged. You know, when I was a kid, I was kind of hyperactive. I think it was because I was smart. I do the homework fast, and I want to joke around with my friends. They put me in a class, a pod it was called, experimental classroom, for 2 years, like solitary confinement by myself. I just read books. Okay, I wasn't allowed in a regular classroom because I thought I goof off too much. Okay, and then my mother told me, I'm not driving you to wrestling practice anymore if you don't behave yourself in school. I'm like, okay, Mom. Okay, but the reason I say that is if I was a kid nowadays, they would have drugged the crap out of me. I'd be, you know, I'd be on 5 psych meds, mental patient by now. All right. Anyway, so that's how the hospital system works, and that's why it can't ever fix itself, because the people at the top, they just want money, and they don't give a rat's tail about the patients, and it can't fix itself. And I think it reminds me a little bit of the school system. Even though a lot of school teachers, they really love the kids, they want to do the best by the kids, the designers of the system will make it in such a way that it's hard for them to help the kids anywhere near the amount that they could. Okay, this is an old ancient Greek painting of Diogenes with a lantern searching for one honest man in the entire city of Athens. Okay, so a couple of jokes here. What's the difference between a lawyer and a doctor? A lawyer will rob you. A doctor will rob you and kill you. Okay, and I'm kind of kidding, but it's, you know, it's a pretty serious thing, having that responsibility of taking care of patients. Voltaire said, I want my doctor to believe in God so that he does not rob me. Okay, and that's kind of what I meant by you need those sort of biblical ethics of the individual is the most important thing. Otherwise, all the pressure's on, rip them off, you know. Okay, and then Voltaire says, it's dangerous to be right when the established are wrong. To announce truth is an infallible method for being persecuted. I'm very fond of truth, but not at all of martyrdom. Those who can make you believe absurdities can make you commit atrocities. So what I'm basically saying is, if you're willing to believe nonsense, you know, funded by the pharmaceutical company that's giving amphetamines to children is a good idea, children will be given amphetamines. And it's like that for a lot of drugs. Okay. They don't really work. All right. Okay. And then you say to yourself, well, what can we do? And I'll briefly remember the story of St. Francis. Okay. He had a vision that God wanted him to rebuild the church, in particular in San Damiano, which was this broken down church, because he was trying to figure out what to do with his life. He was a little bit lost, mixed up young guy. All right. And then the Pope sort of around the same time had a vision. Perhaps some young monk could help restore the church. People have lost their faith and the church is collapsing. So anyways, be that as it may, St. Francis, he went and he built this church. He went all around collecting stones and he rebuilt San Damiano Church. And what I'm saying is, how do we rebuild healthcare? And basically, a couple thoughts. First of all, if you look at any modern hospital, it's usually going to be like, this has been said by Tom Wolfe, the great writer, American writer of the 1900s. He said, all modern office buildings look like animal cages, and then they have a statue of a turd out in front. I don't know about you, but if I'm walking towards a building and there's a statue of a turd in front, that does not inspire confidence, okay? And remember what Dennis Burkin said. He says, if you have small stools because you don't need enough fiber, you need a big hospital. If you have big stools because you eat a lot of fiber, you can get by with a small place, a little vegan clinic, all right? And a little tiny vegan clinic with no technology would cure tons of patients. The modern hospital with all the bells and whistles, all the new stuff, millions and millions of dollars. It can't cure chronic diseases. All right. So I said to myself, where can we get better results? What could be done? And I think we could redo a lot of these college campuses. Now that more and more college classes are going online, I think at least half, if not 2/3 of these colleges or more are going to go bankrupt. And we could refurnish them. Somebody could. And we could teach nutrition there, teach health. Patients could walk around for exercise, very much like what Walter Kempner's clinic was doing in Durham, North Carolina, back in the 1940s, 50s, 60s, 70s, and 80s. And, True North up in California is doing something similar to this. And I think this is a good thing. Maybe telehealth is all that's going to be available. That's a good thing too. But, and just now, people can go on the internet, they can watch these videos. That's good. But I think if healthcare is ever going to save itself and be something where more patients benefit than suffer, something like this will need to be done. I don't have any business skills. I don't really have very good social skills or networking skills. None of that stuff. I'm just a nerd who reads a lot. Okay. But I would love to work at a place like something like this. So if there's anybody out there who can take over a college and hire people, I would love to work at a place like that. I'm kind of bored of clinical medicine. It only requires an IQ like 130. I got an IQ way beyond that. I want to use my brains, my energy, but I just generate a bunch of billing codes like anybody else in clinical medicine. Okay, Spartan Vegan. Oh, this is what I'm saying. God's way of healing, all this health stuff. It doesn't cost anything. It's available to just about everybody. It's free. Basically, you got to eat anyway. So eat the healthy food. And this is what I call the Spartan Vegan Pyramid. At the bottom is all the social stuff, which is very important for health, lowers your stress level, makes you happy, having a sense of purpose, gives you energy, determination. Eat the starches as the main source of your calories. We talked about them. Potatoes, sweet potatoes, rice, beans, oatmeal, quinoa. Eat the fruits then. I think we have color vision so we can see fruits when they're ripe. So I think fruits are, in general, quite good. Got to be a little careful with some of the modern ones made to be extra sweet. They can cause rebound hypoglycemia if you don't eat anything else. And eat your veggies as well. Avoid the ones where they spray stuff on them like avocados. I would never eat avocados or guacamole anymore because they're putting too many toxic preservatives on the outer surface of them and out in the stores. The only thing you probably end up needing to take is B12. I take methylcobalamin. I don't worry about it too much, but that's basically it. I call this the Spartan vegan diet, which is really just a variation on, all the low-fat vegan diets, that other people talk about, like, Dr. McDougall, like, Kempner, et cetera, Predikin and Chef AJ, Jeff Nelson. We all pretty much agree on the basics of it. There might be little tweaks here and there, but we pretty much all agree low-fat vegan is the way to go. Is atherosclerosis reversible? Yeah, it is to a large extent. So it's a blood clot. Things inside of a blood clot is you're going to have acute clot. That's obviously reversible. You're going to have a lipid core, especially like the phospholipids from the membranes inside the red blood cells, and those can be reabsorbed. The necrotic core of dead tissue material, that can be reabsorbed. As far as the fibrous connective tissue, the acellular stuff probably cannot be resorbed. Where there's still a lot of cells in it, maybe. Calcification in general, you think of it as not being able to be reabsorbed. And I've never seen it clinically, and I've seen many, many thousands and thousands of calcified arteries. But, in research studies, some people are now claiming that if you wait years and years, you can actually reverse the calcification partly. So I don't really think that's clinically relevant, but that is something that people are talking about. So anyways, what do you do? Well, if you stop eating the high-fat food and doing other things that predispose to blood clots, you'll have a chance to reverse these things, and you avoid the things that are damaging the endothelium. When you eat a healthy diet, you'll start getting, you reduce your dietary sodium, you reduce your dietary fat, you'll start getting, so you reduce your insulin resistance, you'll start getting the endothelium come back to life, making nitric oxide, vasodilator, antiplatelet. These things right here are EPCs, endothelial precursor cells, circulating precursor cells, and they will form, like a clot forms, and then they cover it up. That's how the clot gets subintimal, by the way. Most people don't know that. That's actually useful to know if you care about atherosclerosis. Okay, so that's some of the key points. This was just a little thing I joke about that, the resurrection of Lazarus, his Johnson. A lot of patients, the Johnson will start working better or even come back to life. I mean, once the vessels are 100% occluded, it's not going to come back to life. If they were just narrowed, it might come back to life. And I made the impotence prayer. Our Father who art in boner land, solid wood be thy name. Give us this day our daily boner, and forgive us our dietary sins, as we forgive those who misdiet against us. And lead us not into temptation, but deliver us from impotence. Amen. So that's basically it.
That was amazing. That was a beautiful talk. Thank you, Father Peter Rogers. Peter is the high priest. He's the Pope of longevity and good health. Can I get an amen? Can I give you an amen? Peter, this has been a religious experience almost. I really appreciate this presentation. In fact, we're going to have Peter back again soon, very soon on the channel. Everyone, thank you for making it to the end here. Please give this video a like, subscribe to VegSource, and subscribe to Peter Rogers. We'll see you on the next one. Thanks.
Thank you.